Well, front page story in the USA today says pharmacies look to snuff tobacco sales. And, of course, that's a big story. I mean, CVS Pharmacy is giving up $2 billion a year in sales. By October of this year, they will have cut out all cigarette, chewing tobacco, and cigar sources of tobacco. And, they say, well, the reason why we're doing this is we're getting rid of a part of our sales that never got bigger, never got smaller, stayed about the same. But what we're doing is taking on something that's a major growth factor now since the Affordable Health Care Act came into play. And, of course, CVS is the number 2 largest pharmacy in America, and Walgreens is the number 1. And both of them are saying, guess what? What we're going to do is see themselves in the near future as an alternative to doctor's office visits. Right now, between the two, there are 26,000 pharmacists and nurse practitioners counseling customers about how to control their high cholesterol, diabetes, and high blood pressure. Well, we know that these are, first of all, cholesterol isn't a danger, but diabetes is a simple mineral deficiency, and high blood pressure could be a mineral deficiency, or it could be obstructed arteries, it could be kidney failure, all kinds of stuff. But these things are all resolvable, certainly preventable through nutritional supplementation, lifestyle change, and so on. So the fact that these top number 1 and number 2 pharmacies are now gearing up to be mini clinics, 1-minute clinics. You go in, you tell them what your problem are, and they give you a program. Okay? Well, what I want you to do is kind of think in those terms. Remember, this is the age of singularity, where all the old stuff is going away. All the brick and mortar is going away. It means all these huge hospitals, except probably for their emergency rooms, all the big hospitals for people going there with diabetes and high blood pressure and kidney failure and obesity, this kind of stuff, this is going to go away. Arthritis, nobody's going to do surgery anymore. I mean, we've been doing this for 36 years now, and we can support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. Nobody, unless you have a really bad trauma, you've been run over by a Sherman tank and your joints are just dust, even then we might be able to help you with nutrition, but, there might be times when trauma will require surgery. But even Harvard Medical School in July of 2002 and in November of 2006 said, both in the Journal of the American Medical Association and the New England Journal of Medicine, don't do surgery of joints, don't do surgery of back for arthritis, low back pain, sciatica, peripheral neuropathies, et cetera, et cetera. They didn't say what to do, but I'm telling you what to do. What don't you do is contact your Youngevity associate, get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. And I want you to learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. That's the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. Now, even if you have complicated medical history, in the book Let's Play Doctor, there's a whole chapter called The Home Laboratory. And in there, it'll tell you how to evaluate your blood tests, the results of your urinalysis, and fecal tests like occult blood test, and the new FIT test is fecal immunochemical test, which are much safer than colonoscopic exams, and they give you almost the same result as far as certainly they do for people without colon cancer. That's actually quite accurate, 95 to 97% accuracy. And for people with colon cancer, they get a 79 to 80% accuracy. So we're talking about things you can do in your own home. We're talking about dollars as opposed to tens of thousands of dollars, and we're talking about safety here. Remember, according to the Journal of the American Medical Association, according to the Center for Disease Control, back in February 5th, 2007, a full-page story in the USA Today, medical doctors in their workplace, hospitals, private clinics, and group clinics, kill, injure, and infect 15 million Americans. Medical doctors kill, injure, and infect 15 million Americans each year in their workplace, hospitals, private offices, and clinics. Multiple doctor clinics. You wouldn't fly commercial airlines if you knew that they killed, injured, and infected 15 million passengers. You wouldn't go to a fast food restaurant if you knew that they killed, injured, and infected 2 million customers. You wouldn't go to a movie if you knew that they killed, injured, and infected 2 million movie viewers. And so why do you go to doctors who kill, injure, and infect 15 million of their patients in their workplace, hospitals, clinics, and multiple doctor clinics? Even screening test. For seniors over the age of 65, doctors kill $15,000 a month. That's $180,000 a year in their workplace. Why would you do that when you could do your own safely for $2 or $3? Just like these test strips for $1.50, you can find out if you have infection, blood, sugar, protein, pH in your urine with a $1.50 test strip. Your doctor uses the same $1.50 test strip, and he charges $800 for a lab test on your urine. And that's because insurance pays. Well, you need to be your own doctor. You need to do your own lab work. Be like me. In a couple of months, I'm going to turn 75. I have not been to a doctor in 67 years with me being the patient. I've done a few autopsies on them. They kind of get stinky after death, just like everybody else. The doctors aren't that perfect. And their average lifespan is 56. They say don't use salt. And, of course, that's why they're in trouble. They need to supplement with all 90 essential nutrients. They need to stay away from doctors themselves. Well, stick with us. We'll be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, I thought we'd talk about back pain today, as we do have a Fox News story here that's headlined, Low Back Pain, What You Need to Know. And they say one of the most common reasons for missed work, and 50% of all working Americans suffer from it. And they're not talking about the common cold or flu. They're talking about low back pain. And they say, according to the New England Journal of Medicine, 31 million Americans experience low back pain at any given time. Say oftentimes back pain is related to aging, like wrinkles and graying hair. Say, of course, the back is comprised of vertebrae that are separated by discs, and they say over time these discs accumulate wear and tear, dry up, get flattened, and occasionally they bulge out to the side. By the time we reach age 30, most of us will show some form of damage to our discs, and they go on to say that this is called degenerative disc disease, and they say we know it isn't actually a disease, it's just a part of the normal aging process that causes low back pain. And they say currently doctors and researchers don't know what causes discs to start hurting. They say disc pain affects certain people, and they go on to say other major causes of low back pain is wear and tear to the joints in the spine. They say when the bones come in contact with one another over time, the bones grind on each other and cause pain. Osteoarthritis is the most common cause of disability in the U.S., and they say another age-related discomfort and pain radiating to through the back to the buttocks and legs. And they say the biggest sign that your back pain is serious is constant pain. Doesn't change when you move around, difficulty moving your legs, and changes in your bowel or bladder habits, and a fever. They say fever with low back pain you should visit a doctor and make sure it's not being caused by an infection, and you should get a CT scan or an MRI to determine. And they go on to say that there's no way to completely prevent low back pain, and there is some evidence that diet and exercise can help. So once again, they missed the mark by a million miles.
Exactly right. Thank you for bringing that one up. In fact, in July of 2002, the Harvard Medical School and their Department of Orthopedic Surgery published an article in the New England Journal of Medicine. It was published in every newspaper. It was kind of republished in every newspaper in America, maybe the world. It says, don't get joint surgery for arthritis. It's worthless. And then 4 years later, in November of 2006, the same group of orthopedic surgeons from the School of Medicine there at Harvard published an article on low back pain. And they said, low back pain, sciatica, which you described there with pain and numbness and tingling and burning down the buttocks and in the feet and so forth. Don't get surgery. Doing nothing is actually much better than getting surgery. Well, I'm here to tell you that we've been doing this for 36 years, Doug, and you know exactly what I'm talking about. We do this for professional athletes. We do it with Olympic athletes. We do it with military personnel, special forces, Navy SEALs. We do this with people in doing heavy industry, a lot of heavy lifting and so forth. We developed what we call the Healthy Bone and Joint Pack, which is designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. We even help people who have had their meniscus in their knees surgically removed following trauma, and we gave them the equivalent to the Healthy Bone and Joint Pack some years ago. And several years later, they re-injured that knee, going down the stairs on their knees. Ooh, awful. The knee blew up like a basketball. The doctors did an MRI, and they said, well, at least your meniscus are okay. And they said, wait a minute, doc, you removed my meniscus 5 years ago. Went back and looked at the record and said, oh, my gosh, you're right. I've never seen it regrow like that. Well, we do this all the time. It's very simple, and none of this has anything to do with age, just like white hair and wrinkles do not have anything to do with age. Neither does joint problems having to do with age. It has to do with nutritional deficiencies. Contact your Young TV associate and ask for Dead Doctors Don't Lie, the CD. It tells you all about it. Get a hold of the Healthy Bone and Joint Pack. Save yourself. I've been doing it for 67 years, and Char's been doing it for 25 years, and we don't have any arthritis. We'll be back after these messages. Okay, Doug, let's go to callers.
Well, let's head to Ohio, and Steve, you're on with Dr. Wallach.
So, Steve, you're on the air.
Yes, sir, Dr. Wallach. My question is, I received your diabetic pack 5 days ago, so I started on that. Okay, my question is, what foods or what things should I stay away from to help my diabetes? And also, another question, I have not been able to get an erection for 4 years. Thank you.
Okay, sure. How much do you weigh?
200.
And how tall are you, sir?
5'7".
Okay. Yeah, I'd like to lose about 30 pounds. Let's see here. We can work on all that. All right. So at 200 pounds, I'd have you take 2 healthy blood sugar packs per month. That would be 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine NutriCrystals Preferred 2.0 over the original formula twice a day. And that would be also 3 of the EFA Pluses twice a day, and then 3 of the Sweeties twice a day. All that would be accomplished by the 2 healthy blood sugar packs per month. And certainly I would have you make sure you're going to stay away. You need to test your fasting blood sugar every morning before you medicate yourself so you don't get yourself into insulin shock kind of trouble. And as your blood sugar drops, you do what your doctor taught you to do, and that is to reduce your medication. You get down blood sugar below 100 for a week without medication, you're an ex-diabetic. You can also do the home A1C hemoglobin test. You want to be down below 5. You want to be like 4.8, 4.7, 4.6, ideal A1C hemoglobin. It kind of gives you some sense of what's been going on for the last 3 months. Erectile dysfunction can be caused by many things. Let me ask you a question. Are you on a statin drug to lower cholesterol?
No, sir.
Okay, good. What is your cholesterol level?
I think the last time I went in there, it was right close to 200.
Okay, just below 200 or just above 200?
Just above.
Mm-hmm. Okay, that's a little bit low. Normal cholesterol is 220 to 270, so if you're like 201, 205, 210, that kind of stuff, you're low. And, of course, testosterone, which is required for all your manly stuff, growing a beard, having body hair, getting erections and producing sperm and all that kind of stuff requires testosterone. And testosterone, being a steroid hormone, is 95% by weight cholesterol. And so we'll talk a little bit more about that and what to do about it and after these messages.
Let's head to Georgia, and Shola, you're on with Dr. Wallach.
Shola, you're on the air.
Good afternoon, Dr. Wallach.
Hi, how can I help you?
Yes, I have 3 issues. The first one is gum disease, periodontal.
Okay.
I have my tooth removed. And the second one is my right arm at the joint hurts. Sometimes when I try to lift it up, I feel it. I feel some pain.
Okay.
And
so you're talking about your hand? You're talking about your hand and your arm hurts when you lift it up?
Yes. At the joint, like at the shoulder, the joint, right there.
Okay, now tell me about number 3.
Number 3 is my heel. The left leg, the heel, I always have pain. Most of the time when I, maybe get up from the bed in the morning and I try to
stand up. Okay. How much do you weigh, Shala?
167.
Okay, and how tall are you?
5'6".
Okay. And do you have any other issues? Any high blood pressure, diabetes, skin problems, any eczema, dermatitis?
No.
Any respiratory problems, asthma or bronchitis?
None.
Did you have your appendix out when you were a kid?
No.
Okay, well, hang on. We'll be back after these messages, and we'll give you a program for all 3 of these problems. We'll be back after these messages. Okay, Doug, let's go right back to Shola. And Shar, this is one of your things, I think. Here's a gal. She's got periodontal disease, receding gums, loose teeth. Her right hand and shoulder hurts when she lifts it up. She got heel pain when she stands on it first thing in the morning. Weighs 167 pounds. What would you do for this gal, Shar?
Well, for sure, get her on a gluten-free diet, but she's got arthritis, and she needs a glucogel, so I'd get her a healthy bone and joint pack.
Okay, at 167 pounds, how many of those would you give her?
Two packs a month.
Perfect. I give you an A+. And, very good. Okay, well, let's do that. Let's, Shola, I want you to, Shar says, let's take 2 healthy bone and joint packs per month. It would be 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine NutriCrystals 2.0, because you do probably have a gluten intolerance, 2.0. That'll be 2 scoops of breakfast, 2 scoops of dinner. And then I want you to get actually come with it, it'll be 3 of the EFA Pluses at breakfast and dinner, and then 15 glucogel, as Shar says. The glucogel, 1 of the large bottle will be with each of those healthy bone and joint packs, so the 2 together will allow you to have 15 a day, 5 at breakfast, lunch, and dinner, and gluten-free, no fried foods, no processed meats or oils, and also with each one of those healthy bone and joint packs, there will be a wide mouth jar of the CM cream, which is an analgesic, meaning pain reliever. It's also anti-inflammatory, and it's going to take 60, 90 days to support and promote maintenance repair of all these tissues that are in trouble here with you, your joints and bones and limbs and hands and things. And so I want you to use the CM cream topically any place you have pain, and usually within 10 minutes or so you're going to get significant or total relief for about 3 to 5 hours. And then call us every 2 weeks and give us a update on your pain here, there, and yon, how your gums are doing, and how your loose teeth are doing. You've already lost a couple of teeth. Tell us about your shoulder and your hand pain. Tell us about your heel, and we'll walk you through this. Okay, Doug, let's go to callers.
Let's head to Lincoln, Illinois. And Linda, you're on with Dr. Wallach.
Linda, you're on the air.
Yes, I need to know what to take. I'm a diabetic, congestive heart failure. I can't walk over 50 feet without a cane. I had a back injury, and I had surgery, and they messed it up more. My feet, my legs hurt all the time. I have a...
Wait a minute. What kind of surgery?
Asthma.
Whoa. What type of surgery did you have?
They removed 2 discs, but they didn't put anything in.
Okay. All right.
I got a high blood pressure. I got gout. On my one toe, I have a knot. They say it's arthritic knot, but they won't operate on because I'm diabetic. I get neuropathy, terrible. My feet hurt terrible all the time. Arthritis. I had a partial hysterectomy. I was always skinny before then. Now I'm 250.
And how tall are you? 250 pounds?
5'5".
Yeah.
5'5".
Oh, yeah, you're 100 pounds overweight. Okay?
Yeah.
Yeah, so you got your pen and paper out, dear?
Yes.
Okay, I'm going to ask you 2 questions before I hand this over to Shar, and I'll repeat all this stuff. So, Shar, you may want to write all this down, Shar, but answer 2 questions here. Do you have any skin problems, any eczema, dermatitis, psoriasis, or dry skin? Any rosacea?
Dry skin.
Okay. Did you ever have any respiratory stuff, bronchitis, or asthma any time in your life?
I have asthma, too.
Okay. How long you had asthma?
They did my surgery in 91, and that's when they found out I had asthma. I didn't know it.
Well, did you have any respiratory problems before that? Nobody called it asthma, but you had respiratory problems?
Yeah. A doctor went to, kept accusing me of smoking, and I never smoked.
Mm-hmm.
And he kept
how long had you had respiratory problems? Since you were a kid or a teenager?
I would think so, yeah.
Yeah. Okay. And did you ever have your appendix out? Did you ever have your appendix out?
My appendix busted as they were taken out when I was 16.
There you go. There's a bingo. Okay, Shar, you know what her basic underlying problem is? She has diabetes, she's got neuropathy, low back problems, she's got congestive heart failure, and...
She can't absorb anything because she's got a gluten intolerance, and that's causing all these other diseases, and they keep adding... Every year you get a couple more diseases because you're not able to absorb what little nutrients are in the food.
Shar. I have a question for you. Yeah. If you can't absorb anything, how come she gained 100 pounds?
Because she can gain sugar, but she can absorb sugar, but that's it.
She can absorb calories, absolutely, but she can't absorb nutrients. Very, very good. And that's why it's kind of one of those paradoxes. If you can't absorb nutrients, you can absorb calories. And so it's not unusual for people who have gluten intolerance to be overweight.
Yeah.
Right. Okay. So what would you give her? 250 pounds. Give her the ideal amount. And if and this is Linda, we're going to give you the ideal amount, and this is for a 300-pound person because with all your problems, I'd be a little heavy-handed here. So we're going to dose you as a 300-pound person.
Yeah,
but
she needs 3, and she needs she needs the healthy bone and joint pack because of the arthritis and everything. But she also needs sweeties for the diabetes and de-stress for the congestive heart failure.
Perfect. A plus. Okay, so what I'd have you take, as Shar said, 3 healthy bone and joint packs per month. That'd be 3 ounces a day, 1 ounce of breakfast, lunch, and dinner of the Osteoarthritis Plus, 2 scoops of the Beyond Tangerine 2.0, drop dead, gluten-free, NutriCrystals 3 times a day, 2 at breakfast, 2 at lunch, 2 at dinner, 3 of the EFA Pluses at breakfast, lunch, and dinner, and then 20 glucogel a day. Okay, because you're going to have 3 of the healthy bone and joint packs per month. I want you to take 20 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner, and 5 at bedtime with a glass of water. And then, as Shar said, because you have congestive heart failure, I'd have you take 3 of the de-stress capsules, capital D like David, dash stress. I'd have you take 3 of those 3 times a day, be 3 bottles a month, that's 9 a day. You could even take 12 a day, take 4 bottles, be speed up the process, 4 at breakfast, 4 at lunch, 4 at dinner. And then, let's see here. Because of the gout, you're going to have some joint pain. I also want you to take, you'll have 3 bottles of the CM cream that come along with the 3 healthy bone and joint packs. And so that would be, you just put the CM cream on any joint that hurts. Within 10 minutes, you should get significant or total pain relief, and that'll last 3 to 5 hours. And again, you want 9 to 12 sweeties a day for that diabetes. Be sure you're taking your fasting blood sugar every morning before you medicate yourself, and as your blood sugar drops below 100 every day for a week without medication, you're an ex-diabetic. And the neuropathies will be dealt with, support and promote maintenance repair of the disc between your vertebrae, push the vertebrae apart, take the pressures off the roots of the spinal nerves. And if you're on medication for congestive heart failure, as you're feeling better, you want to make sure that you talk to your cardiologist because he'll want to reduce and as you lose weight, you're going to want to reduce the medications, okay? The dry skin and the asthma will go away when you're on a gluten-free diet. And if you want to speed up things, if cost is not a factor, you can actually take the ASAP for weight loss. Take a dropper full under your tongue 30 minutes before each meal. Let's start light there. And 1 bottle will last you a month at that rate. And then be sure that you call us every couple of weeks. You're welcome to call anytime. Call us every couple of weeks. We want to know your weight. We want to know your blood pressure. We want to know blood sugar levels, all that kind of stuff. Hang on, folks. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And Doug, let's go to callers.
Let's head to Texas. And Marion, you're on with Dr. Wallach.
Well, Miriam, you're on the air.
Hey, Dr. Wallach.
Hi, what's up?
Hey.
Yes, ma'am.
I'm calling on a friend. Her mother had stomach cancer back in 2013, and she's in remission. She had chemo, and the thing is, when she initially was diagnosed with cancer, there's some number that they gave her that it was at 600, and then after chemo, so 3 months ago, it went down to 16, and then now it's gone up to 50. The thing is, so we want to see what you have to say about what you recommend for her. I know the antioxidants and everything, but in the past, back in 2010, she had some huge trauma to her body, and so she's on like Keppra and Ritalin and all.
Tell me how much she weighs.
She's 150 pounds. She's 5'6". She's got high blood pressure and cholesterol. Had a hysterectomy in 2012. No skin problems, no respiratory problems, and no GI problems. Okay, very good.
All right. Let's see here. Basically, whenever you have any cancer, obviously you got to change whatever you're doing, particularly stomach cancer. I want her to give up all fried foods, absolutely no fried foods, no exceptions. No oils, it means no margarines, mayonnaise, salad dressing, cooking oils, no coconut oil, no olive oil. If she's canned fish, it's fine, but they got to be packed in water, mustard, tomato sauce, not oil. And then, at 150 pounds, I would go ahead and give her, I would go ahead and give her 2. Let's be a little heavy-handed here. I would give her 2 of the healthy digestion packs per month. Give her a full dose of everything twice a day. The exception will be the Ultimate Enzymes, which come with the 2 healthy digestion packs. I want her to take 1 to 2 of the Ultimate Enzymes, like 2 to 5 minutes before each meal with a couple ounces of water. I'd also like her to get 2 bottles of our Ultimate Selenium, so she could take 3 of those twice a day. That's one of your best friends when you have cancer. I would always, Shar, what's your favorite new product?
Immortalium.
Yep, absolutely. And certainly what it does is Immortalium supports telomere life, which adds energy for your body to stimulate the production of stem cells and also encourage stem cells you already have to do their job. And the purpose of a stem cell is replace damaged tissue with healthy tissue. And so Immortalium is a perfect thing here for anybody with any kind of cancer. And so Shar's choice there is just right on, A+, Shar. And basically what I would like you to do for her is I'd go a little heavy-handed here. I'd give her 3 times a day, 2 at breakfast, lunch, and dinner. That'd be 2 bottles a month of the Immortalium. And I'd take 6 a day myself just for prevention. I'm very excited about this. It's just great for your skin, great for your hair, great for your eyes, great for internal organs. It definitely is very exciting. It's based on the technology that was developed for the 2009 Nobel Prize in Medicine. It's just really great stuff, and so we're very, very proud of this new product. And as you're pointing out, antioxidants are a great thing. These particular ones are designed to extend the number of times that the chromosomes can actually duplicate. When you look at what's called the telomeres, they're the end caps on the chromosomes, kind of like the little plastic thing on the end of your shoestrings that keeps them from getting all fuzzy and you can't get it through the hole. But basically, the telomeres shrink every time your chromosomes duplicate, every time there's a daughter cell. And it's been limited to 51 duplications, called the Hayflick limit, after Leonard Hayflick, the guy who recognized that in cell cultures. And I think now, because of the Immortalium, we're going to have what's called the Wallach limit. We haven't, we're looking at this in cell cultures now, but basically I'm looking at duplications of chromosomes and the extension of the life of the telomeres. And so what if it's 65? What if it's 70? What if it's 80? What if it's 102? Double the Hayflick limit. We're excited. We're going to call it the Wallach limit. Okay? So give us a call. Let us know how this gal does. This will be where I would go. Call us every 2 weeks. Well, thank you, everybody. Thank you so much, Char. Great job. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.